Bismillahirrahmanirrahim. Let's just talk about a very common disease as you see in your common practices, which is acne. The main problem with the diagnosis is not the diagnosis but the treatment from layman point of view, because most of the people start treating every disease of the skin with betonate in Pakistan. So your probably role as primary care physician is to dispel that myth that not everything is treatable by steroids. We'll go over a lot of slides just to make you familiar with the acne, how does it present, and again we will just clarify some of the basic concepts, and if your basic concepts are clear, obviously you are going to be able to treat it very easily. Now this is a typical case of acne. It could be just these small little bumps which are basically papules. Anything which is above the skin is papule, and the red papules mean that something inflammatory is going on. Now acne can be inflammatory, so there some of the papules can be inflammatory, or it could be more inflammatory and basically all centered around the center of the face or lateral side of the face. So that's not really a big issue. They can be comedones. Comedones is basically the open black papule. So this is basically jisko aap blackheads bolte. So they could be blackheads, which is the open comedone, and the reason why it happens we are going to talk about it in a couple of seconds. Again, inflammatory acne. As you can see, these are the two very common kinds of acne that you'll get to see in your clinical practices. Basically the redness in the acne makes it inflammatory acne, and its treatment is slightly different than the comedonal, purely comedonal acne, where you don't see a lot of inflammation. Why don't you see a lot of inflammation in comedones? We are going to talk about later. Again, now acne can cause horrible scarring. That is the only reason we really need to treat acne. Otherwise acne can occur or start at age, for example 15, and it will go away by itself by age 20. So we don't really need to treat acne for that, because it's a self-limiting disease. Why do we care about acne is because it can leave horrible marks, and those marks or those scars are much more difficult to treat than the acne itself. It can leave the scars on the face, it can leave the scars on the chest, and sometimes it can leave atrophic scars. So scar can be upwards growth or it can be downward. So it can be atrophic or hypertrophic scarring. In many instances it can even lead to keloids. So keloids are the scars which are bigger than the actual insult. तो अगर छोटा सा स्कार था बढ़ते बहुत बड़ा हो गया, that is a keloid. Again, this is the example of keloid. So this is not the acne, this is the result of acne. It's a keloid scar. So you don't need to treat acne in this patient, just need to treat the scar. Again, acne can be accompanied by some hair growth on the face, as in this woman, but you'll see a lot of more pictures that if acne is accompanied by hirsutism, and hirsutism by definition is the growth of hair on the face which is dependent on androgen. So अगर कोई female हैं और उनके androgen dependent areas में like a beard बहुत ज़्यादा घने बाल जिस तरह के सर के होते हैं उस तरह के उगाएं, तो that is called hirsutism. Otherwise जिसको आप रुआं बोलते हैं, जिसको आप peach fuzz बोलते हैं, that is basically hypertrichosis. If a female has acne and hirsutism, you ought to be very careful in just telling her that it may not be acne, it may be some hormonal issue. Especially you want to make sure that the patient is not having polycystic ovary disease or hyperinsulinemia syndrome. Acne, it's a myth that acne doesn't really bother males. Acne does bother male, and it can actually affect males much worse than females. So acne can be a common problem in males. Acne can be in every race, region, and it's very similar in all the areas. So these are all different pictures I just wanted you to show. Now this is an interesting acne which is called the steroid induced acne that we are seeing a lot more in this country because of the non-regulation of the medication. Anybody can buy anything from the counter. So this is steroid induced acne. So in other words, betonate induced acne. Alright, so acne can be caused by steroids. It could be topical steroids, it can be oral steroids, or it can be inhaled steroids as well. So people who are having asthma and they are giving inhalers, a lot of inhalers, they can also start having acne. Many drugs can cause acne as well, especially isoniazid, and there's a long list of medications that can cause acne. So make sure that the patient is not taking any of those medications before you just start treating acne. Now, not only adults can have acne, infants can have acne as well. Just like this, in this patient, infantile acne is there. So infants can have acne, especially when the patient's hormones, as you can you know very well from your previous knowledge, that they can actually cross the placenta, and before they are completely gone from the system, it take a few months. Now, why does this disease occur? That is the crux of the matter. That is where we have to spend a couple of minutes. So once this concept is clear, I wouldn't really need to tell you the treatment, because you can actually devise the treatment by your own. It's a very, very simple concept. This is the sebaceous gland, which is basically the basic problem. So sebaceous gland is attached to a pipe. Pipe is basically follicular canal. So आपका जो hair है, that is basically placed in a canal. एक टेस्ट ट्यूब में पड़ा हुआ है आपका हेयर. जब आप हेयर को निकालते हैं तो हेयर तो निकल आता है, लेकिन टेस्ट ट्यूब की जो दीवार वहाँ पे रहती है, दैट इज बेसिकली द ग्रोइंग पार्ट ऑफ द हेयर. दैट्स वेयर द ग्रोइंग पार्ट ऑफ द हेयर इज. सो दैट इज follicular epithelium. वो जो दीवार है, दैट इज मेकिंग दिस. सो दिस इज द टेस्ट ट्यूब which is follicular canal. Hair is placed inside this. Now, sebaceous gland is attached to. Sebaceous gland makes sebum, which is basically a moisturizer to the skin. So I always, tell myself many times that Allah has given us so many wonderful automated things that we cannot even imagine. So when we say thank you Allah Mia for all the other things, we should say thank you Allah Mia for moisturizing our skin 24 hours a day, 365 days a year for the rest of our lives. Why? Because this moisturization, if you don't have it enough, as you may see in some of the retinoid treated patients, you can start having extreme dryness to the skin. All right. So this moisturization, this is one part of making sure that you have moisturized skin or lubricated skin. There are other parts to it also, as you will learn in the next lecture, but this is a very integral part. Now, the problem is that this sebaceous gland, after it makes sebum, it spills that sebum. तो sebum कहाँ गया? पहले इस canal में आया, उसके बाद ऊपर आके उसने lateral sides of the skin are moisturized or lubricated, basically, to be very specific. Now, what happens in acne is, let's go back. So from a pathophysiology standpoint, you can now make out the pathophysiology of what does it occur. Either there is increased sebum gland activity, sebaceous gland activity ज़्यादा है कि वो आगे से निकल ही नहीं रहा, इतनी ज़्यादा sebum बन रही है, or it could be abnormal follicular keratinization, as I told you, or it could be, or in addition, it could be anaerobic pleomorphic diphtheroid propionibacterium acnes infection on the top of it, and increased androgens and decreased estrogens. Again, they cause the same problem. They increase the sebaceous gland activity. So androgens or male kind of hormones actually increase the activity of sebaceous gland. Female kind of hormones decrease the sebaceous gland activity. Now, when we want to treat this disorder, we have to reverse this order. तो अगर हमारी sebaceous gland activity ज़्यादा है तो हमने उसको कम करना है. अगर इन्फेक्शन हुई है तो उसको ट्रीट करना है. अगर केराटिनाइजेशन खराब हो रही है तो उसको हमने फिक्स करना है. That will actually fix your acne. That will treat your acne. Now, this is exactly what happens. So once you have this sebaceous lobule, it keeps on expanding. This follicular canal keeps on expanding, and after a little while, it bursts. Now, sebaceous glands, as I told you, produce sebum. Sebum is chopped down, it is broken down into some acids which are called basically fatty acids. Fatty acids are extremely inflammatory molecules. That's exactly what happens when we do the liposuction. जब हम liposuction करते हैं उतना फैट नहीं निकालते जितनी उसमें inflammation cause करते हैं. Because when we do the liposuction, we are basically breaking the adipocytes. आपके फैट सेल्स को हमने ब्रेक कर दिया. जो वहाँ से सीबम जो वहाँ से फैटी एसिड्स निकले, उन्होंने इतनी इन्फ्लेमेशन कॉज की कि आपकी जो पेट की दीवार है वो बेसिकली जाके फेशिया के साथ जुड़ गई, फाइब्रोज हो गई. एंड देयर ऑल्सो इन्फ्लेमेशन मेक्स द प्राइमरी इफेक्ट. Here also inflammation is causing the bad effect. There we are trying to take advantage of inflammation. Here inflammation is causing the inflammatory acne. Now up to this level it could be just the comedone. यहाँ से यहाँ inflammatory हो गया acne. Now जब inflammation हो जाए तो you have to treat acne with antibiotics. Prior to that, you don't need to give them the antibiotics. All right, so we'll just skip those slides. There are other kinds of acne that you'll have to just remember. I will just let it. Now, there are certain kinds of acne that you should remember. There are some occupations in which acne is more common. So, one is that your sebum becomes sticky. The other option is that you are having some sticky material from outside which will clog the pores or which will clog the follicular infundibulum, follicle ki jo opening hai. That could be any kind of makeup which will clog that pores or something in the air. So people jo kharadiye hote hain, for example, there are small droplets in the air of the oil which can cause the plugging of those infundibulums of the hair, and that can cause acne as well. Alright, there are other kinds of acne that I'm not going to go through. Let's just go to the last. Alright, now we want to decrease the sebaceous gland activity. What are the medications which will decrease the sebaceous gland activity? It's the tretinoin or isotretinoin. It could be oral or topical. It could be anti-androgens, for example, spironolactone, and estrogens or estrogen heavy contraceptives. If you are going to give somebody contraceptives, I don't really recommend it as the first line. It should be the last option in the, if nothing else works, then oral contraceptives. But among the oral contraceptives, you want to give somebody estrogen heavy oral contraceptives. So that will decrease the sebaceous gland activity. You want to normalize the keratinization. Again, the fortunate thing is that the same things which decrease the sebaceous gland activity also normalize keratinization. Keratinization वही है कि जब जिल्द बन गए तो उसके बाद गिर भी जाए at the appropriate time. So tretinoin, isotretinoin, the newer molecule adapalene also does a wonderful job. Antibiotics, it could be topical or oral antibiotics, and tetracycline groups are more favored ones because it has combination activity against all the molecules, but other antibiotics can be given also. Antibiotics should be given only if it's inflammatory acne. And alright, I'm done. And comedolytic agents. So if the sebum becomes sticky, if it's too sticky, it has to be normalized and it has to become more fluidy, and that is called the comedolytic activity. And again, minocycline and tetracycline agents have proven to be extremely good for that. And with that, I finish my talk. Thank you so very much for listening.